Welcome to Break the Needle. I'm your host, Adam Zivo, and I'm here to tackle Canada's problems with drugs, addiction, and crime. Today, we're joined by Earl Thiessen, Executive Director of Oxford House, an Alberta based recovery centre. Earl is an Indigenous Canadian and a vocal advocate for Indigenous-Informed addiction treatment, which has gained a lot of traction in Alberta in recent years. Thanks for joining us, Earl.
Thank you, Adam. Good seeing you again.
Now, Earl, when you say, or when we say, Indigenous informed addiction treatment, what does that actually mean in practice?
In practice for the area I'm in, it's more in practice. It's all reconnection, connection to our ways of life. Physically, spiritually, mentally, emotionally, and for that, that's the meaning of holistic treatment. Is getting back to healing the four elements of our being.
Okay, but how do Indigenous understandings of addiction differ from the dominant medical or psychological models?
See, that's where there is a huge separation because in Western culture, we view it as a the effect of the brain, right? The chemistry of the brain, whereas Indigenous culture, it's basically soul healing, I guess you could say. Your soul is fractured from all of the traumas that we've experienced, intergenerational, everything.
Okay, but if we talk about the fracturing of the soul, is that something that has an analog, for example, in a psychological based approach to addiction, for example?
I mean, when in the Western culture, we say, you're healing, I guess you could say, which is in the indigenous culture is similar but different. It's not, we don't use medical terms in our culture, right? It's all about reconnection, right? And
Okay.
they say the opposite of addiction is connection, and that's true to life for our people.
Well, so what historical and colonial factors shape both addiction itself and responses to it in Indigenous communities?
For the most part, it goes back to 60 scoop residential school. I mean, every culture has trauma, but that's to me that's to us. That's Canada's black eye, right? Every country has uh, situations that happen, but in Canada, that's the major one that was hidden for so long. We're celebrating leaders who initiated the whole residential school genocide. Basically, is what it was, right?
Okay, so there's an intergenerational trauma here where
Yes.
the Indigenous children who were taken from their families and put in these schools, unfortunately, that left them with lasting trauma that predisposed them towards addiction. And then they pass this trauma on to their children, not in
Yes.
all cases, but in some cases, creating a cycle. And that, of course, is an important part of the narrative around why we need specialized care for Indigenous communities. What I'm wondering,
Yes.
though, is what risks arise when non Indigenous institutions attempt to incorporate Indigenous knowledge or practices into their treatment models? How do we scale this?
It's there's a lot of tokenism, I would call it, going on up until 10 years ago. Like we've been around for 30 years, 25 years we've had Indigenous recovery housing. Up until I would say probably not even 10 years. Now it's everywhere. Where was it 25 years ago? Right. And that's kind of the meaning of tokenism. People are, and I hate saying this because a lot of my colleagues have uh, cultural practices at their centers and everything. But it's heartbreaking that it's tied to funding, that it's tied to appease the general public, to get likes, to you know what I mean? It's not something that comes and goes. This is a way of life for us, and intergenerational trauma is just it's rolling over, rolling over, rolling over. Right? You were
Mhm.
taught anything punitive was punished,
Okay,
and
so
that
we
just
have
keeps carrying.
these non-indigenous institutions which are saying that they are interested in indigenous practices, but their commitment to these practices are quite shallow. When we get back from the break, I want to hear from you what these practices look like on a day to day basis. Thank you.